And I will keep the chat open in case anyone has any questions as well. All right, perfect. And everyone can see my screen okay?
Yes.
Perfect, okay. So again, I'm Peter, I'm one of the residents. You can just call me Peter, is totally good. Yeah, I represent the resident geriatrics interest group here in the Calgary area. So my talk today will be maintaining optimal dental health as we age. Some of the objectives that I wanted to go through was a review of the components of the mouth, changes in oral health as we age, preventative health, which will probably be the most important part, some of the changes in your mouth that you want to watch for and things that you might want to tell your dentist or your doctor if you see changes, and when to see your dentist and how to stay safe, particularly during COVID. And then finally, I have some Alberta specific resources. I'm sure many of you already know about them. I have no conflicts of interest to declare, and my views don't represent those of the University of Calgary or the internal medicine program. So in terms of the parts of the mouth, the oral cavity, as we all know, is designed for digestion, communication, and breathing. The entrance, we have our lips, which then transition to mucous membranes, which are the softer tissue inside your mouth. The roof of the mouth contains both the hard and the soft palates, and this is a bony structure that transitions to a muscular structure. And these are helpful to separate both the nasal and the oral cavity, which is essentially the nose to the mouth. The floor of the mouth, which contains muscles, tongue, and salivary glands. And then there are nerves throughout the mouth as well, which both aid in the sensation of being able to chew and taste. And sometimes when there's issues in the mouth can cause pain. And then of course there are your teeth, which help you to bite and grind food. And these rows of teeth form deep roots into the bones into the bones of your mouth. So there's some changes that we want to be that occur just with natural aging, and this is just a quick overview of them. The inner membrane that we talked about earlier, or the mucosa of the mouth, typically has a self-protective or self-cleaning mechanism where the skin will continually replace itself. And as we get older, there's decreased turnover, so it doesn't heal as fast. This can sometimes lead to increased risk of infections, particularly oral thrush, or slow down wound healing after we have a tooth removed, for example. It's in these situations that it's particularly important that mouth appliances like dentures fit properly, since they can affect this oral membrane. Most of us, as we get older, tend to eat less as well, and this leads to decreased appetite and food intake. And this can cause, sometimes if you're not eating enough food, insufficient amounts of essential nutrients such as calcium, iron, and zinc. And in older adults who don't get enough sunlight, insufficient vitamin D can be unsafe for bones. In terms of our salivary glands, we don't typically produce as much saliva as we get older, and this can lead to both mouth dryness and predispose us to cavities. I'll talk about this later as well, but this usually happens in conjunction with many other medical conditions, as well as the medications that are used to treat them. And finally, our teeth are made of a layer of enamel, which is essentially protective for us. These tissues, again, typically do have some level of turnover, but it slows down and becomes more brittle with age. And then there's reduced blood flow to the teeth as well. And because of that, they don't have those same restorative properties. So one of the most important parts, of course, and the crux of most of my understanding of dentistry, because I'm not a dentist, is prevention. So as we all know, mechanical removals with a soft toothbrush is the standard to prevent plaque mechanically. Those with gingival recession should avoid further recession or abrasion. So in those situations where the gums of your teeth are starting to recede, you want to make sure that you're using an extra soft toothbrush, light pressure, and any modifications that your dentist might recommend. Those that are wearing dentures should ensure that the dentures are mechanically cleaned daily. And of course, use a toothbrush for 2 minutes and avoid hurting those gums. As we get older, we have other medical conditions that sometimes can make it harder to use a toothbrush. And there are different situations that we can use to help manage this. Some of them, of course, are things like mechanical toothbrushes for those who might have arthritis, or toothbrush handles. There are some buckle straps or grippable handles that are also options for those who have decreased mobility. If those aren't readily available, you can also consider wrapping a sponge around an elastic bandage or a tape, or sitting with your elbow resting on the countertop if your arms are feeling a little tired from all the brushing for 2 minutes. I would also recommend to clean your tongue regularly because that's an area that can build up with bacteria. Rinses are kind of a controversial topic, and many of them exist for different reasons. Whenever you use a rinse, you should probably do it in consultation with your dentist for these other extra types of rinses. Some of the common ones are chlorhexidine, which is usually used for gingivitis, which is inflammation of the gums surrounding the teeth. Fluoride, which can help to prevent dental caries, and it also helps to remineralize the teeth. Studies have shown that generally there are positive effects with water fluoridation, although there's definitely some level of controversy. The CDC continues to recommend fluoridation in our regular water, which helps to reverse tooth decay and accounts for fewer cavities, less severe cavities, and a decreased need for fillings and tooth removals. I think fluoride is just a little bit interesting in the way that it prevents dental caries. It does have some antimicrobial properties itself, and the studies, which are quite large, of over 23 countries that have been studied after fluoride's been introduced into water, have shown a 40 to 50% reduction in cavities after the fluoridation interventions. I'll talk about nystatin a bit later as well for oral thrush. Floss every day if possible. There are also other options if flossing's hard, for example, interdental brushes or water picks. Some of you may remember in the news a couple years ago bringing into question how effective flossing is. And again, I'm not a dentist, but I think it's important that these studies are put into context. So many of the studies that were done are poor quality and studied specific outcomes in short-term periods. And what I mean by poor quality is there's sometimes a risk of bias when doing these studies, and they might not all be controlled into all the elements that we want to look for to answer a specific question. So whenever you compile large amounts of data, and what we call a review of all the data, it's only really as good as the sum of its parts. So if you start with poor quality studies, you might not necessarily get the answer that you're looking for. Ultimately, the conclusion of this is that periodontal disease, which is again the inflammation around the gums, which is really what we use flossing for, is really complex, and there's many factors that are associated to it. Dental associations continue to recommend flossing or using an interdental cleaner once a day. So I think it's important that we try to make it a consistent habit and floss regularly. Dentures. About 5% of the population has dentures, and this number is increasing, but there are also a lot of people who still have teeth. For those who do have dentures, they shouldn't be worn all the time as it can affect the tissues of the mouth. There's recommendations to have them out of the mouth at least 6 hours a day. And the places where the dentures cover the mouth should be cleaned and massaged. Dentures themselves should be cleaned and rinsed. And even if you have dentures, use a soft toothbrush for your gums, or clean and massage those gums, or you can use a finger wrapped around a clean, damp cloth. The current guidelines from the American College recommend daily removal because, daily cleaning of your dentures because bacterial biofilm forms in the oral cavity and can also form out those dentures. And cleaning them can help to prevent inflammation of the gums. Dentures should be placed in water when they're not being used. And sometimes people can also be recommended adhesives to help form a seal at the top or where the dentures sit. And this can help to prevent food from getting in between the denture and the mouth. The studies for these adhesives have shown that it improves quality of life, although there isn't enough evidence to show that it actually improves your ability to chew. I think the take-home message is that if you're using adhesives, that's probably going to be good. But if you notice that you're using much more adhesive and increasing it in order to get a good seal, you should probably go see your dentist to get a check of the fit on your dentures. And finally, diet. As we all know, there's a food guide, and it's recently been updated, I think about 2 years ago. I recommend healthy vegetables and fruits, getting your proteins throughout the day, make sure you're drinking enough water, and avoiding things like smoking, tobacco, and alcohol consumption. Sugary foods and drinks, they make it hard for your body to keep the water that you're absorbing. Not only does the sugar increase your risk of cavities, but it can also dehydrate your mouth. There are alcohol consumption guidelines for adults, or actually for adults, 1 per day for females and 2 per day for males. And you want to make sure that you're, again, fulfilling your daily amount of nutrients. And that usually ranges from 1,600 to 2,400 calories a day, depending on how active you are. Diet's a really interesting thing because oral health status may affect what you're able to eat, but it also kind of goes both ways. So while nutrition can help prevent diseases in your mouth, making sure that your mouth is healthy also helps you to have good nutrition. So that's why it's important that these go hand in hand, and maintaining your health has both a component of taking care of your teeth and eating well. The next part of this talk is some of the changes that you want to watch out for and things that you might want to let your dentist or your physician know if you've seen these changes in your mouth. First one is dental caries. I'm sure we've all experienced this before. About 1 in 5 older adults have untreated cavities. These can be both above the gum or in the root itself. The most common symptoms are pain and brown discoloration of the tooth. And treatment really depends on where the cavity is, which is the next slide. So the standard treatment is fluoride, which is a mineral. And these are typically used when it's an early cavity. It helps to restore the minerals on the teeth, and again has an antimicrobial effect, so helps kill the bacteria on the teeth. It stops the cavity from going deeper into the teeth. Fillings. I've had way too many fillings as a child, and as the name implies, after the cavity leaves a hole in the teeth, dentists will clean out that decayed teeth and fill it with material that helps prevent further damage. And it also helps prevent the teeth from chipping or cracking, which can occur if the teeth becomes unstable. Crowns are an artificial tooth which kind of covers a damaged or decayed tooth, and again protects it from further damage. And root canals are when the decay goes into the blood vessels and the nerves. It can cause quite a bit of pain. So the procedure involves cleaning out the teeth, removing the damaged nerve and the decayed material, and then again filling it with special compounds. And then the alternative that we're trying to avoid is complete removal of the tooth. The next is gum disease or periodontitis. About 2/3 of older adults have some level of gum disease. The symptoms that you want to watch out for is usually right around the tooth itself. So it usually presents as red or swollen or bleeding gums. Sometimes people also notice loose or shifting teeth. So gingivitis is kind of the early phase of that, where there's inflammation of the gingiva surrounding your teeth. And it's from bacterial plaque buildup that inflame the gum tissue. When it becomes severe enough, kind of under here, there's a plaque that's formed, and it affects the ligaments that actually help to hold your teeth. So that's what we call periodontitis. And when periodontitis forms those plaques, it also forms a pocket around the tooth, and then it causes bone loss around the teeth. And if advanced enough, can make the tooth become unstable. There are risk factors for periodontal disease. One of them is diabetes. It's a very complex mechanism that I'm not sure we have all the answers to, but our understanding is that there's decreased healing and a higher inflammatory response in those who have diabetes. Other things that you might notice if you have diabetes is what's called burning mouth syndrome, which again, not fully explained, but as the name implies, you have that symptom. And I think it's from the neuropathy, perhaps. Yeah, so overall, it's very important that we pay attention to gum disease before it causes shifting and unstable teeth. In terms of the treatment, again, depends on the severity of the disease. You can start with things like mouthwashes that can contain chlorhexidine. It doesn't remove existing plaque, but helps to control the buildup of any further plaque. Regular chlorhexidine, however, should be avoided, which is why you should probably go to your dentist or your physician before you ask for a chlorhexidine mouthwash, because it can stain your teeth. Plaque can be removed with scaling and polishing, which they regularly do at most dentist visits. This is when they scrape away the teeth and polish it after. And then root planing, that's when there's damage to the gums, and the dentist will also clean under the gums. And sometimes when you have severe gingivitis, they can also use antibiotics. Xerostomia is the sensation of having a dry mouth, and that can be the lips, the tongue, the gums, anywhere inside the mouth itself. It's about 30% of those over the age of 65 can have this sensation. And it's actually primarily due to the side effects of medications, but sometimes can also be due to a medical condition itself, such as diabetes or Parkinson's disease. Usually the symptoms are a swollen, dry, red tongue, a burning sensation, changes in your taste, or difficulty with speech or swallowing. And why we worry about a dry mouth is that it can increase your risk of having inflammation in your mucous membranes or causing cavities. So it's recommended that you drink and sip water throughout the day, and again, avoid high sugar or alcoholic beverages. If that's not enough, there's also sugar-free chewing gum that can help stimulate saliva production, and saliva substitutes that can be bought over the counter. Again, these are just the treatment options, and one of the types of sprays, of course I don't endorse it personally, that can help provide the sensation of saliva to help prevent dry mouth. Oral thrush is also called candidiasis. So candida is a type of yeast that's normally present in our mouth. It's when it becomes, there's overgrowth that can lead to inflammation. And the most common conditions that lead to a dry mouth is from dental irritation, the use of steroid inhalers. So if you have a puffer for asthma or emphysema or COPD, for example, this can increase your risk of getting thrush. And then other systemic diseases such as being immunodeficient, using antibiotics, steroid use, or chemotherapy, these can all again increase your risk. Some people have no symptoms at all, while others have a burning sensation or a bitter taste. And then if you look at your tongue, it kind of looks like this. There's this curd-like plaques. It almost looks kind of cheesy. That can be removed if you scrape it with a tongue depressor. And then there are other places where oral thrush can also be present, including the corners of the lips and on the palate, again, where if you had dentures, the dentures might sit. So treatment is pretty straightforward. You want to use things like antifungals, because that's essentially what candida is. It can either be topical, so it's essentially a mouthwash. I'm sure many of you might be familiar with this, or you can either swish or swallow, or swish and spit it out. Usually for 7 to 14 days, and it's about 4 times a day you'll use it. Usually they want to continue the treatment for at least 48 hours after symptoms are resolved. And if there's a situation where after you try the topical, it doesn't go away, there's also systemic antifungals that can be used. Oral cancer is the last thing that I just want people to be aware of, and it's of course not the far beyond my expertise. But they're the 8th most common cancer worldwide, and it can include all parts of the mouth, from the mouth to the throat. What you want to watch out for are non-healing ulcers or masses. They're commonly treated with, commonly treated with surgery, but you'll want to watch for these white or red colored patches, and then they'll develop an ulcer or a mass. So anything that lasts over 2 weeks should be seen by a physician and be considered for biopsy. At this time, there's no evidence for screening, but for those who have symptoms, you should absolutely talk to a healthcare provider. Particularly if you have risk factors such as previous extensive alcohol use or smoking. The treatment for this is, again, past the point of this discussion today, and it would depend on a multidisciplinary team. And depending on the type of cancer, it would include surgery, radiation, or chemotherapy. I just wanted to make a note on some other important conditions to be aware of as well. So as mentioned previously, many patients can have dry mouth, and most of the time this is due to medications. About 39% of older adults use 5 or more prescription drugs and 2 or 3 over-the-counter medications. And many of these medications cause side effects, particularly dry mouth and to our salivary glands. The most common in these groups are antidepressants or antipsychotics, pain medications such as opioids, which which all again cause dry mouth, puffers as mentioned earlier, and diuretics, which cause dehydration, of course. There are sleeping aids as well, particularly what we call anticholinergics, so things like gravel, which actually reduce your salivary glands from producing saliva. So if you're having these symptoms, you should go to your doctor and ask about if any of the medications that you're on might be causing you to have a dry mouth. And in terms of patients who have dementia, there's a very large variety in the severity of dementia and the domains that they might affect. For some people, they might have no effect at all. And again, dementia is essentially when your brain makes it more difficult for you to do everyday tasks. So for some, that might be brushing their teeth. And while a number of studies have shown no difference in the amount of plaque buildup in those who have dementia, there's again a very wide a wide variability in the severity of dementia. So typically those who have moderate or severe dementia might need supportive care to maintain oral hygiene, whether that's cleaning their teeth or helping to clean their dentures. All right, I just gotta grab a drink of water because I don't want a dry mouth either. So it goes without saying that oral hygiene is important. And most of my understanding of dental health is in prevention. And we want to help to prevent pain, inflammation, or decreases in saliva. And all of these might make it harder for you to do the things that you normally would do, which is like eating, talking, things that are essentially fundamental to what we do on a daily basis. And again, oral health has a large impact on our health. And there's associations in oral health to things like food selection, to the weight, again, if we're not eating as much, if we have poor oral health, speech, and even psychosocial health and our quality of life. Large studies have reported associations between oral health and general health, and those are particularly have been in those with diabetes, heart disease, and lung disease. And those who have difficulty chewing are also at higher risk of infections because of things like aspiration events, which is when they choke on food. So we want to prevent all of those things from occurring, which is through prevention, again, by brushing your teeth, flossing daily, cleaning your dentures if you have dentures, and then soft brushes if you use dentures, and a healthy diet. I wanted to make a note on COVID-19, of course, because of it is concerning when you go to your dentist. You want to make sure that you're being as safe as possible, as well as your dentist being safe. So there are conditions when you should see your dentist, and you don't want to delay these things again because it's important to maintain your teeth and all the tissue around your teeth. So things like severe dental pain, inflammation around or surrounding the gums, an abscess. So if you have a painful pocket where you think it's almost like pus or an infection and you have a fever associated with it, if you have a tooth fracture, and sometimes dental treatments might be necessary prior to certain medical procedures, for example, like replacements of heart valves. Any other emergent or urgent procedures, you should talk to your dentist. And ideally, if you're able to see your dentist every 6 months, that would be the goal. So during COVID, it's important to remember that COVID is primarily transferred by droplets, and it will be present in your saliva if you have COVID. And it's important to wash your hands again before and after you brush your teeth, don't share your toothbrush with anybody, and avoid having toothbrushes touch if there's anyone else in your house. And when you go to your dentist, ensure that you have your mask when you enter. Of course, that's an Alberta guideline now. It might be helpful to also have protective eyewear, such as safety glasses. It certainly wouldn't hurt. But mostly the person who's most at risk is probably your dentist or your dental hygienist. They should be wearing a face mask and eye protection. And unfortunately, while we would think that things like scalers or air water syringes create aerosols because it's shooting air into your teeth and into your mouth, sorry, and all those droplets are being pushed out into the air. There really isn't enough data at this time to prove that it actually creates aerosols. So ideally, if possible, those should be avoided during the pandemic because we don't have enough data. But if they're necessary, such as emergency procedures, then having high suction close by with an assistant or dental dams where it covers your mouth might be potential options. And finally, if you have symptoms, stay at home. And then finally, there's no evidence that pre-procedural mouth rinses, so if they give you a mouthwash beforehand, that it would reduce the transmission of COVID, but it certainly would reduce some of the bacteria in your mouth, so it can't hurt. And if there's an opportunity for telehealth, this may work for you as well for things like education and counseling and assessing if you need a referral or need to be seen by your dentist. The last slide I had, and of course I'm happy to share my slides at the end of this, is a section on Alberta Resources. Essentially a list of different resources. I recognize that dental care is not provided by the government for everybody. For anyone over the age of 65, Alberta Blue Cross will provide partial coverage, but I've also attached a form here that may help for a reduced fee in dental care, in particular clinics. The two that I'm aware of are Sheldon Schumer and the Northeast Dental Clinic. And again, caring for teeth is important, which is why prevention is certainly the most important thing of the talk today. And here are just some of the other community health programs, and then how to brush and floss and make sure you're doing it properly. And here's my contact information. Does anyone have any, it's pretty much the end of the talk. Does anyone have any feedback or any questions at all? And I will stop sharing. You're muted, Colleen.
Yes, I have a question.
I'm so concerned about trying to not have the background noise for you. I muted myself. I'm sorry, someone said they had a question?
Yes, it was me. Lichen planus issue in the mouth, and recommendations are more like corticosteroid, which can cause other problems. I've read that this could be an autoimmune disease. What could you tell us about this? I'm not treating it. I was told that use of oracort could lead to mouth issues. It might cause what's the white stuff that you mentioned before?
The thrush.
Thrush. So I was reluctant to use that again. So I'm living with this. Can you tell me any more information about it?
Yeah, so as you said, lichen planus, it's usually when you have an autoimmune condition where it forms plaques around the skin, anywhere in the anywhere your skin, your scalp, your nails, or the mouth itself. The reality is that most of the treatment for it would be high potency topical steroids, like you mentioned. I think there are other treatment options that are available as well, but because it's an autoimmune condition, generally those are kind of immunosuppressive in nature, is my understanding. I understand there's some systemic therapy, ones that would you would take as a pill form, but usually at the referral of a dermatologist is my understanding. Mm-hmm. So I think that I see that the difficulty in that, if you use an immunosuppressive agent, it will increase your risk of thrush. So what I would probably recommend is if you try to minimize the amount of time, the duration at which you're using these topical corticosteroids, or you go to a dermatologist to consider an alternative agent that might be helpful for you as opposed to steroids if that hasn't been working for you.
I've been using this thing, you didn't mention it, Xylol, I don't know if I'm saying it right, where you put a tablet in your mouth to increase secretions during the night, or it could be in the day, to address a dry mouth situation which might have some impetus on it. I think you said you didn't approve of those. I'm not sure. It begins with
Oh,
F.
no. Sorry. Yeah, I think saliva or substances that increase saliva production are great.
Okay.
I don't endorse any particular brand name. It was just the picture that I had up there.
Mm-hmm.
Yeah, I use Biotine. I have a lot of trouble with dry mouth, especially when I wake up in the morning. My mouth is really dry. Is there any problem with using that, or should I be trying something different?
To be honest, I don't think that there's any concern with using anything that would help help you with saliva. Biotin's the one, I mostly work in a hospital setting, and it's the one that we use in hospital as well for most patients who have a dry mouth. So I don't have any recommendation against it.
Okay.
I think Suzanne has a question there.
Oh, hi, thank you. It was very interesting. I'm so glad that this was on today. I have two questions. I have a fibroma on the top of one of my front teeth, and it has been there since 2013. And sometimes it swells up more, and sometimes it goes down. And for the last 2 or 3 weeks, it was very red and vicious looking. So I use what the dentist had given me about 6-7 years ago, 0.12% chlorhexidine, and I understand that that's like a disinfectant, right? Chlorhexidine.
That's right. Yeah.
And it took away the real intense redness and reduced the size of this fibroma. What's the difference between a fibroma and gum disease?
So fibroma should be what we call a growth of tissue. And it's usually just connective tissue that's in your mouth, or I guess anywhere where there could be connective tissue. This is quite different from gum disease, where what's happening is that you have bacteria that are residing in your gums, and that can cause the redness and the inflammation. So it's possible that what might have happened is that there was some bacteria that was building up around this fibroma and causing the inflammation. So by giving it the chlorhexidine, you might have just treated any bacteria around there. It would be my guess.
Yeah, so a fibroma is what? It's just a sort of like a not a dangerous growth, or it's a buildup of extra tissue, and maybe from having had some trauma at some time, I guess, or I don't know.
That's a great question. I'm actually not sure of the causes why fibromas occur, but my understanding is that they're quite benign. It's just a growth of tissue.
Okay, because I had one on the side of the tooth, that at the the side of the tongue, that was taken out a few years ago, and it was a fibroma, and the ear, nose, and throat doctor said, you know what happens? He says, sometimes you end up biting down on that side of the tongue, and over time you end up getting a little scar tissue, and that's what results in the fibroma. So the second thing I'd like to ask is I use Preventative sensitive. It's a 1.1% sodium fluoride, and I use it once a day only to help prevent, to strengthen the roots and have less pain, you know, below the gum line, because my gums are receding. And I'm wondering, does fluoride cause the teeth to become brittle?
No. So the studies in fluoride, is that some sort of mouthwash or is it just a
No.
paste that you?
No, this is the dental paste that I use.
Hmm.
It's about $13 from London Drugs, and it's especially for people who are having like recession. And what it does is, I think it gets into the little tubules,
Mm.
you know, below the gum line, and it
Mhm.
kind of prevents them from getting more damaged or getting rotten out. It basically helps to prevent the tooth and build up the tooth structure, I think maybe below the gum line.
Yeah, so my understanding of fluoride is from those large studies that were done by the CDC is that beyond the antimicrobial properties, they actually help to remineralize bone and help to prevent bone from being broken down. The only question I would ask about that one, and it's again beyond my expertise, so it might be something you want to talk to your dentist about, is if the concentration of the fluoride's enough, or what concentration they would recommend if it's for pastes and mouthwash, because they're very different between a toothbrush that you use, the water that you drink, and a mouthwash.
Oh, I see. Okay, well, it was recommended by the dentist, and it's about maybe the highest strength that you can get, you know, at a dentist.
Okay.
And then the next is when you are at a drugstore, and the next would be when you go in for dental cleaning and they give you a fluoride treatment, which is maybe 10, 20 times stronger than this. But okay, thank you. Thank you. It was very interesting. It gets very expensive to do dental work when you get older. Whew.
Yeah. I do think that just my personal opinion, it's the fact that we don't have coverage for dental hygiene, but despite the fact that it's been proven to be so linked to your health, is again something that we can always be asking questions about.
Mm-hmm. And maybe just a quick third question. I take the amoxicillin 4 pills before I go. You know, that's not really damaging to the body, right? To take those before a dental appointment.
Usually normally we use antibiotics prior to procedures to prevent infections in the blood. Usually with tooth extractions only, because we're worried about an infection that goes to your heart.
Okay.
Yeah. Unless your dentist, of course, recommends it for another reason.
Okay, thank you very much. Okay.
And Diane had asked here through chat, Peter, if Calgary adds fluoride to our water. Can you touch on that?
Yes, my understanding is that Calgary does add fluoride to the water, and unless it's, I'm pretty sure Alberta does.
And that was some great information that you shared, because that was a question that I had as far as, you know, where a lot of seniors may not be following through on their dental care because of cost. So it was great that you listed some resources there for people that might need some support in order to be able to do that. So we'll share that information again after following the presentation. We'll follow up and make sure that everybody does have that information in case they need it. Are there any particular toothbrush recommendations that you might have for us?
That one, I don't have any particular one. It's really just if you're having difficulty using a manual toothbrush, then I'd recommend a mechanical one. But beyond that, kind of beyond my level of expertise, I don't,
Personal preference. And and I appreciated you sharing that information about, you know, so many people have concerns about, I know myself, I'm more than ready for my normal checkup and clean, but a little intimidated to go at this point. So that was great information that you shared about ways to protect yourself, or how maybe the questions you should ask your dentist about how they're protecting us during the procedure. Also what to look for, the types of things that put us at risk. So that was great information as well. What's your take on bleaching at our stage of life?
like as a whitening procedure?
Yeah.
Again, a question I think you should ask your dentist. It's just not something that we typically see as physicians. Or mostly concerned with things that the medications and the medical disease conditions that might affect your mouth and hygiene. and preventative care as a whole, as opposed to these more nuanced topics that unfortunately I wish I knew more about, but I apologize, I don't.
I just wondered if, sometimes I wonder if it's beneficial or if it just wears thin your enamel on your teeth. Anybody else have any more questions for Peter?
I've got something to share.
Oh,
I don't know if anybody, I'm not trying to sell anything, but in the last month or so, there's this company, probably other people have heard of it, it's called Young Living, and things expensive. For this toothpaste, because I've got some tenderness, and for a year I've had this thing that I mentioned, that's an autoimmune thing, this little lumps inside your gum. I found that this does not irritate at all, and the person through which I got it told me her mother-in-law had bad teeth, and after she was using this, they had cleared up. It's in a set of things called Thieves, but it doesn't have. I got wary about toothpaste irritating your gum because of some of the things they've got in them. If you read them, you're like, well, that's not too great. So this thing, it's called. Let's see what it's called. It's essential oil infused, and it's gentle, and I'm finding it, like it's peppermint, spearmint, essential oils, and it seems to be less hard on the teeth and gums, gentle. So I found it helpful, and I've tried for a year with this problem in my mouth. This doesn't irritate at all and is helpful for the teeth. Anyway, anyone wants to
I'm familiar with the Thieves through this COVID situation. People were using Thieves Oil in their diffusers, and it's basically various essential oils that are supposed to help to clean the air. So somewhat familiar. I didn't realize they have toothpaste. Have you any comments on that, Peter?
Yeah, I've seen some studies that they're mostly run by the manufacturer, the drug company, that have suggested that mouthwashes that contain essential oils are quite effective when combined with toothbrush, of course, for preventing plaque buildup on your teeth. So jury's still out, in my opinion, because these studies are it's still quite new. I've only seen them for over the past 5 years or so, but it seems to be something that might be effective and reduce the amount, alcohol mouthwashes people are trying to avoid nowadays. So this might be another alternative to them.
I can quickly read what's in it. Water, calcium carbonate, cocos nucifera as a coconut oil, sodium bicarbonate, glycerin. Oh, it's got xylitol, gum, mentha, peppermint oil, leaf extract, stevia, leaf extract, lecithin, eugenia. There's a lot of different oils. All I can say is it's got rosemary leaf oil. So
sounds quite natural.
Yes, it's natural.
Mm-hmm. And I think you have to purchase that from someone that you know that sells it. Is that
probably?
I don't think
Yeah,
it's
Young Living. The center is in Calgary. They've got a delivery place in South Calgary. Yes, southwest of Calgary.
Oh, that's good.
No synthetic dyes, no artificial flavors or preservatives.
Oh, that's good information to share. Thank you very much. I don't see any other questions in chat. Does anyone else have any questions or anything they'd like to offer, Suzanne?
Okay. Okay, I'm wondering, there are some toothpaste with silver in it, and also others that have tea tree oil. And in fact, every evening after I do the flossing, I do a little, a little brush, and I put a little bit of tea tree oil. Is tea tree oil hard on mucus tissues? I know that maybe we're not supposed to use it near the mucus tissues, but it seems to make my gums a lot cleaner. And what about silver? Because that seemed to have helped too. No problems with that, is there?
It's a great question. I'm not sure about the tea tree oil one. When I looked up the essential oil study, it was actually very difficult for me to find out what essential oils they actually had in their mouthwash. So I'm not sure about the tea tree oil. The thing with silver nitrate, again, silver is really good at as a disinfectant, but I think it can also stain your teeth. So it might not be something that you want to use totally regularly all the time.
Okay.
Yeah, another thing I would ask your dentist about.
Okay, thank you.
Thank you. Anyone else?
I have a question. Can you hear me?
Yes.
Are there any dentists specializing in geriatrics in Calgary?
I think the ones that I'm most familiar with would be the ones that are that were mentioned with Sheldon Strumier, because those they provide resources for adults in the lower income bracket. So that's who I'd imagine are are I guess familiar with geriatric patients. But beyond that, I'm not sure.
Okay,
That's
thank you.
a good question. A lot of people might want to know that. Anyone else? One of the things that I was interested in, and you touched on, was the that a lot of us are on inhalers for various reasons, and concerns about the potential of thrush or sore throat. Is there any other damage that inhalers can do to your teeth aside from the potential of thrush?
To my knowledge, really it shouldn't be anything beyond thrush. And that's why they typically recommend, if you're using one of the steroid ones, to rinse your mouth after you've used the inhaler. And
the product that you referred to, I think it was nystatin, is that something that's by prescription or something you would get over the counter?
Again, only in hospital I'm super familiar with, but I'm quite positive that it's something that you have to get prescription.
So if you happen to have any of those symptoms, then it's best to see your doctor then, or maybe your dentist.
That's right.
Excellent. Anyone else have any questions? I don't see anything further here in chat.
About salt.
Sorry?
You know, I did sang for a long time, and my teacher just said, rinse your mouth with salt water is quite effective. I was wondering about if one actually cleaned the teeth with salt, would that be damaging?
I don't think it'd be damaging. My mom also used to tell me this all the time. But there's no comparison studies that I know about that compare things like just salt to another mouthwash. I can't imagine that it would be better than fluoride, though, if you're going to use it to brush your teeth. So I don't think there's harm. Whether it's better or worse, I'm not sure. I don't know if there's any studies showing that.
Suzanne?
Yeah, just one other point is that 2-3 years ago, I had 2 teeth at the very back that were both abscess, and it was a lot of bother and pain because it went into the bone. It took a few years for one of them to clear up, and the other one had to be extracted after having a root canal. And after that, I got fitted with a night guard, and I realized that I lost one of those teeth because I'm a clamper at night. And because I had, teeth taken out, the night guard at night actually prevents your teeth from moving. And that was a point that I thought maybe I should, mention, because when you have teeth extracted, which happens, more often when you get older, your teeth start to move because there's a hole and the bone starts to recede. And night guards are very good to keep the teeth in place. And it's not difficult to do. You slip it on at night, and that way you're not grinding and you keep your teeth in place. Very good. And Blue Cross covers a good portion of it, like maybe 70 or 80% of it. So it's worth it for $400, because if you're the type of person that, grinds teeth, or that you're tight in your jaw, you could save a lot of money with just that night guard. And it's more comfortable because your jaw can relax at night.
Yeah, I think that's a great point, especially for grinders. You don't want to continue to wear down that teeth because eventually they'll have to put crowns on it.
Mhm.
Yeah, because in fact, one of those two teeth was fractured, and the dentist said probably because you've been grinding, you've been tense on those teeth, and you know, a night guard, I think it's well worth the money. You just treat it like a denture, except it's sitting in the water during the day, whereas your dentures in the day are sitting in your teeth, you know, in your mouth. So it's just the opposite, right?
That's right.
Pete, what about orthodontics for seniors? Is it recommended when you talk about teeth moving and that kind of thing? Are orthodontics recommended for seniors?
Yeah, another great question. Yes, really difficult questions, Colleen.
Yeah.
I'm not sure, to be honest. I think the most important part is figuring out why your teeth are moving. If it's something due to periodontitis, then those should be treated as opposed to moving the teeth back around from an orthodontist. I'm actually not super sure what they might have to offer in terms of as an orthodontist.
Yeah. Mm. Well, definitely the night guard, the dentist said, it'll keep your teeth in place all right because it's fitted and molded exactly to your teeth, and they just stay in place.
I'm seeing some chats coming in here. I'm not sure if everyone is seeing them. Zoe mentioned the fluoride between 1,000 and 1,500 ppms in normal toothpaste and 2,800 ppms to 5,000 ppm by the dentist. And so I'm not entirely certain, Zoe, what you're referring to there. You're suggesting that what you're getting when you get the fluoride added dental treatment is far greater than the fluoride in your toothpaste. Is that?
I think it was a comment to my earlier when I was talking about the fluoride paste that one of the other residents was using.
Mm-hmm.
And she wanted to say that that she's a maxillofacial dental nurse and thought your presentation was very easy to follow and not over informative. And Daphne has suggested that if commercial toothpaste bothers you, you can try baking soda. When you were talking about salt, I kind of wondered about that. I think some people use just straight baking soda, and I've seen some toothpastes with baking soda in it. And Val was interested about the information about the night guard, and Zoe also mentioned that teeth can move naturally as we get older, so the night guards can help to ease that pressure. So lots of good comments coming in there from everyone. Thank you very much. Is there anything that anyone else has that they would like to ask or offer? And
I've got a comment. The person mentioned the teeth moving. If you require an implant, let's say, I really recommend not letting it get to the stage of an abscess or something like that before you have it, because I had an implant, I don't know, for a year, 18 months, whatever. I had to wait a very long time before they were able to do that.
Oh,
thanks, Gordon.
okay.
And the teeth moved in the meantime. So the gap they've left for the implant will get smaller as the other teeth move along. If there's a long period of time between the initial treatment and then having to wait while bone repairs and stuff like that.
Okay, but
I'm going to have another one next week, and he's going to put it in immediately,
be very careful.
which is amazing. I'm like, how can you put an implant in the same day? I guess someone else is talking, but the lesson is get in there early before you've got any great dental infection, because the infection will delay the amount of time required to put that implant. Your teeth get time to move, and then you're getting gaps between the other teeth, and there's not space for the original implant if you're not careful. If you've got to wait 6 months, teeth are moving during that time.
Okay, I'm sorry that we had a couple of little interruptions there, Val. I apologize for that, but such as when we have our group discussions like this. So we appreciate everybody joining us today. I'm going to try to do a little screen share here myself as we close out, unless anyone else has any thing that they would like to offer. I think that we can close out today. And first of all, I'd just like to say thank you very much to Dr. Hoang for the great information. You know, it was so much more than I even understood was important about looking after our dental health. So we appreciate you being here and providing that information. As I said, we will make sure that we share this once we get the videos, video edited, and then up on our YouTube channel, our Kirby YouTube channel, then we'll let you know, so that if you would like to go back and revisit, or if you anything in the meantime, just make sure you email me and I'll put you in touch with Dr. Hoang. Also, just wanted to make sure that everybody is aware that Kirby Center is open now to the public to offer our critical services. And that we are a mask distribution center, so that if you need masks, we offer free masks, and they can be picked up at Kirby between 8 and 4 Monday to Friday, or if you need them, just call and we can arrange to have them delivered. But as you see, all of our critical programs and services are open for you, and these numbers will be on screen for you as well in case you need them for future reference. And I am hoping that you will plan to join us for our future, for our upcoming presentations. Very excited about what we have coming up for the month of October. And with the support of Sanofi Pasteur, we have a full month of presentations about health and wellness, particularly during COVID and infectious disease, influenza, immunization season. So beginning on October 1st, which is also National Day of Older Persons. So in celebration of that, we will be doing a presentation on empowering life through preventative health with Dr. Dion Neem and Milo Stanilchik. And then following that, empowered eating for immunity, which, as Dr. Hoang touched upon, important for your dental care as well, on October 6th, as well as maintaining mental well-being in isolation as fall comes and we naturally get closed in, or with isolation coming upon us. Padma Ganesh from Alzheimer's Society will be chatting about our mental wellness. Then on the 19th, we'll be having a group discussion, a COVID-19 outlook, the impact of infectious disease. And that also is the day that Alberta Health Services kicks off their immunization program. So discussing immunization for the various infectious diseases, how to go about getting them while you're in isolation, that kind of thing. And then lung health and respiratory infections, how they may put you at risk for some of the infectious disease that we may be seeing this fall. So that is, I think, going to be very valuable information for you. So full month in October, and then right into November, talking about financial wellness, wills and estate plannings, and that kind of thing. So we've got a lot of information coming up for you, so we'll hope that you will join us again. And thank you once again for joining us. And again, thank you, Peter, for your information. And also just to remind you that these online sessions are free of charge, and donations are always important to help to support the programs that and can be made online. So we appreciate any help that you can offer to help us to continue to the outreach programs supporting seniors in their homes.